Good morning, everyone. Thanks for joining us this morning to hear about COVID-19 vaccine distribution, as well as taking a deeper dive into healthcare talent trends here in Northern Colorado. Before we shift into these topics, I want to share a few housekeeping items with you, as well as introduce our sector partnership leaders for updates on key committee work. So first, we ask that you remain on mute, but be sure to use that chat function to share comments and questions. You can also raise your hand via the reactions button at the bottom of your screen. Please note this meeting is being recorded this morning. All right, second, we have released our 2020 annual report, which you can find on our website at nocohealthsector.org. And also, I'm proud to share we were profiled in a recent case study by the National Sector Partnership Leader NextGen Sector Partnership. As one of the longest standing sector partnerships, we shared key milestones and tips for success to help guide other sector partnerships in their launch, progression, and sustainability. And you can also find this case study on our website. Nikki has also thrown it into the chat there. You can grab it this morning. We'll work through some committee updates this morning. First, I'd like to introduce Melissa Henry. She is co-chair of our workforce committee. She's going to share an update on their activities. Good morning. Oh, maybe it's Evan this morning. Good morning, Evan.
Hi, Joanne. Sorry about that. We threw you a little loop there. Yes, good morning, everybody. I'm Evan Hyatt. I'm the Director of Marketing and Communications for Care Synergy. We support 3 hospices and 1 large home health organization up and down the Front Range. And I am the co-chair, along with Melissa Henry, of the Partnership Workforce Committee. Nikki, can we go to the next slide? Do I have? The Workforce Committee, we meet the second Tuesday of every month in some fashion. Since COVID, we've been doing that all virtually. It's from 2:30 to 4 on that second Tuesday, and we alternate each month. We meet as the large committee or the full committee one month, and then the second month or the next month we meet and break out into these committee subgroups that you see now on the screen. One group is focused on work-based learning and career exploration. They've done a wonderful job of starting to dive into some virtual events to work on that. And in the next slide, we've got that highlighted, and you'll see it on our website. We share those events. There that is. The next one is March 24th. And it's focused on internships and apprenticeships in healthcare. And you can see the breakdown of the schedule there and what's anticipated to be featured during those timeframes. This information is also on the NoCo Health Sector Partnership website. So you can go and see more there and learn about how to get connected to that. Our second subcommittee group, Get Into the Guts, is focused on highlighting career pathways in healthcare. And when we could go out and do this in person, they would take middle school and high school students on tours of health facilities. Both large health systems participated as well as other providers. And now they've adapted and have gone virtually and are now, I think their first one was just recently filmed this last weekend and focused on the eye center of the Rockies. So you'll see that coming out soon. And then 2 other groups that we have real quickly that aren't as active right now. We have a data team in case we need to focus on doing research and gathering data. And then a communications group that makes sure people are aware of the things that we're doing. So if you have interest in working with or helping on the workforce committee, you can reach out to me or Melissa, and or just join us. If you want to contact Nikki, she can get you on the email distribution list to get our meeting updates, minutes, and then also get on the list to receive the invitations to the meetings. And so that's what's going on in the workforce committee these days. And I think up next, Anna Vandriel is going to talk about the behavioral health committee.
Yeah, thank you, Evan. Good morning. My name is Anna Vandriel, and I work at Columbine Health Systems, and I chair the Behavioral Health Committee. We've been very, very active this last probably 6-9 months. Last year, we did an inaugural behavioral health event at UNC, which we are now replicating at CSU tomorrow. And the event the goal is to inspire that next generation of behavioral health professionals. And so it's a conference style event. We have a couple panels. The first one is direct service, so people who work directly with patients, clients, consumers. And then the second panel will be those that are more in the support role or indirect role to try to capture those people that are in degrees that may not necessarily think about as behavioral health, but certainly could be part of an organization to help support what they are doing. We also have different sessions, breakout sessions, to learn more about what does it mean to get a certification and licensure? How can you get experience while you're working on your degree, or even in high school? So that will be tomorrow, 10 to 1:30. And again, it's hosted by CSU, sponsored by City of Fort Collins. And our partners are across Larimer and Will County. We've invited high school students this time around because it is virtual. Excited to do that because we can catch them early and get them inspired. That's even better. But also we've invited CSU, UNC Front Range and Ames students to come. So we're excited for that one. It's our second event. And then the other kind of initiative we've been working on as a committee is creating videos of professionals to be able for students to just look at. And to, again, try to inspire them and help them understand what it means to be in behavioral health and to create that passion. So we have 6 so far, and it's posted on our YouTube site. And Nikki, if you don't mind posting that in the chat, then we can, people can look at that. And so that's what we've been working on. And our hope with this initiative is to expand it in this time of COVID to maybe do some tours, video tours of different organizations and be able to do interviews of different levels of staff as part of that video. So that's what we've been working on, and would love to have people join us. We meet the second Wednesday, 8:15 to 9:15 in the morning, virtually. So reach out if you'd like to participate. And I will hand it over to Yvonne to talk about PASSAR.
Good morning, everyone. It's too early in the morning to talk about PASSAR for those of us that know about it. So the pre-admission screening and resident review. As we know, the 1135 waivers that have been going on for, well, it'll be a year in April, have discontinued PASSAR from moving folks from the hospital to the nursing home unless they're still there in 30 days and we must follow up. But very exciting news. The state of Colorado has changed vendors. And at this point, the PASSAR system will be managed by Telegen, and a branch of theirs out of Montana, who has been doing this PASSAR with the state of Montana for 4 years. So I'm super excited about that because their website, their portal that you use for the PASSAR system has history. So if a resident or a patient that we are working with does have a long history of mental health opportunities, then that information and history is there to help the next receiver of that patient be able to care for that patient well and know if they can meet their needs. And so that's super exciting. That starts March 1st. The only other thing I would add, our meeting is next Wednesday at 7:30. So if you're interested in learning more or joining the PASSAR team, you can join us next Wednesday. Put it in the chat if you'd like to join and I can send you an invite. The 1135 waivers at this point are continued until April 21st. The state of Colorado keeps saying PASSAR will start up again on April 22nd. As we know, the acting Health and Human Services Director for the nation has sent 50 letters to all the governors saying the public health emergency may be continued through the end of the year. That would continue the waivers then at that point. So everyone's sort of waiting for the appointment of the Health and Human Services Secretary to know when those waivers will continue or not. So that's keeping PASSAR in the limbo as well. Anyway, we're a tiny little committee that works on a big old project. So if you're interested in PASSAR, please put it in the chat and I will get you connected. So thanks for joining us.
On the next slide here, you'll see our committees as outlined from our chairs here moments ago. There's contact information there and the schedule for meetings. Please engage with the chairs if you'd like to join in any capacity. And next, I will introduce Angela Richard, who is going to moderate our COVID-19 vaccine distribution panel.
Hi, thank you. Super excited today to have some wonderful panelists that will be with us to answer some questions that we have. The way that we are going to structure this is I am going to start off with having Tom Gonzalez introduce himself, and I understand he has a few slides. So if you want to go ahead, Tom.
Sure. Good morning, everyone. My name is Tom Gonzalez. I serve as the Public Health Director for Larimer County Department of Health and Environment. Thanks for having me. Appreciate all the work you do. Just want to give a brief update on our vaccine distribution here in Larimer County. And before I jump in, I really want to say it is an extreme partnership with all our providers, as well as Sean May and Mark Lawley over Will County Department of Public Health and Environment. We work very closely, all our teams, in working on distribution in the NoCo way. So I appreciate the collaboration. It's kind of the way we do things here. I think it's working very well. I talked to other public health directors around the state. We have a really good partnership with our hospital systems, our pharmacies, and all our providers. And that makes a real big difference, at least on the communication end of it. So appreciate all the partnership there. Next slide. Just a visual here regarding distribution in Larimer County. We are all in the phase 1A through 1B, point 2. So that's certainly all our non-healthcare workers, our moderate risk healthcare providers, our first responders, our 65-year-old and up, our educators, K through 12, as well as our child care providers. As you see here in Larimer County, that's 98,000 people, give or take. And we're getting about 10,000 doses a week in Larimer County. That is slightly up about a month ago where we were about 7,500. So we have seen an increase, but nowhere near where we need to be to vaccinate 98,000 people in a very, very timely manner. However, we're doing a fantastic job here as quickly as we can. With all our providers, one thing that's very important, we're not having any vaccine sitting around. As soon as we get it in, we are getting the shot in the arm, and then we're not wasting any shots. Pfizer, we can typically get 6 out of the vial of 5. Moderna, sometimes 11 out of the 10. So we're getting shots in the arm as quick as possible and wasting no doses. Next slide, please. Just some progress. This is as of Monday. We're going to update the numbers Wednesday, but you see we've given almost 80,000 shots in the arm, which just over 54,000 or 15% of our population here in Larimer County has received 1 dose, and just about 7% 2 doses. So that's really important. Our wildly important goal that the governor has set, we were just at 67% one dose for our 70 plus residents. I am assuming we're very close now to being at 70, or at least within the end of the day we will, with a couple of our big clinics going on. But it's really important with this age group to get the 2 doses. So we're up to 32%. And I know many of us have a large clinic set this week for that 2nd dose for our 70 and up. Then there is this disparity with white non-Latinx versus non-white non-Latinx and Latinx residents. We are working on some strategies there. But one thing I am learning from our population epidemiologists that the current eligibility of 1A through 1B.2, the number of eligible Latinx individuals is much lower than when we go to 1B3 with the frontline workers and comorbidities. So what we're doing, next slide, is working with our partners in the state to put up a pop-up event. You may have heard about this, but a really neat approach. The state health department has put a program together called the Equity Point of Distribution pop-up, where they're taking 10% of all the vaccine that comes into the state from the federal distribution. They're setting that aside. And then this is only being dedicated to these pop-ups. And so our plan we submitted last week today actually, is to look at essential workers who will be facing access or hesitancy issues among our Latinx community. So we'll be working with our chambers, our Economic Workforce Development Center, and our businesses to do this pop-up. We hope to do it in the next week or two. We are hearing that the governor may open up 1B3 as soon as March 5th. So we wanted to be ready, primed, and ready to pop up this pop-up to vaccinate this group. So we're excited to have this in. We're also going to be looking at other ways we can provide pop-ups, whether that's rural Larimer County where access, whether it's hesitancy issues, whether it's people that transportation, homebound, whatever it may be. We're also looking at long-term care. Now that that federal program is over, we want to make sure that new residents and new staff, healthcare staff, are getting vaccinated in a timely manner, because the work on the vaccine there in the long-term care facilities is saving lives drastically. Our cases since the second dose got in the arms of most of our residents has dropped by 90%. And the 8 cases we had last week, 6 of them were individuals that had 2 shots. They were asymptomatic. They didn't really even get sick. So the vaccine works, and we're so excited. We want to make sure we continue to vaccinate that very, very high-risk population. I think next slide. Oh, there it is. I'm sorry. There is the slide. I actually had it to showcase the great work with the vaccine in our long-term care facility. So that is fantastic. We want to make sure we're working with all of our long-term care facilities, 54 of them in Larimer County, to keep that vaccine going within those establishments. And lastly, just like you'll learn from Weld County, we have online signups. So you can get in the queue if you're eligible, if you're 65, 70, you're an educator, et cetera. But maybe you don't know where you're at in the queue. Maybe you don't have internet. Well, we have our Joint Information Center, 970-498-5500 is the number. Monday through Friday, 9 to 4:30. It's a must answer line. So you get a live person. We are going to expand the hours to go into a couple nights a week, evening and Saturday morning. We just got to get some people hired, excited to expand it. Maybe you don't want to talk to somebody live. You can text or email us. You'll get a live person and we can work you through. We've had situations where a person accidentally got on the wrong queue. They were 70 and up and they signed up as a provider. So they called, we were able to get them into the right queue, and within 2 days, UC Health or Banner or Salute or Sunrise, whomever, got them vaccinated. So it's, if you hear somebody saying, well, I don't know what's going on, I've been waiting to, it's in Larimer County, tell them to call that number because we don't want them to be missed. Last slide, I think, is just questions, if there are any.
So I think, Tom, I'm going to go ahead and work through letting the other panelists introduce themselves, and then we'll get to some of the questions.
Sounds great, Angela.
Thanks so much. I want to introduce our other panelist from Weld County, Sean May. Hi, Sean.
Hi, good morning.
Tell us a little bit about yourself and about what Weld County is doing.
Sure. So my name is Sean May. I'm a Public Health Services Director with Weld County. I am technically over the COVID response, both the epi investigation side and the vaccine side. I'm really taking kind of more the lead on the vaccination side personally. And so kind of an operations section chief there. Anyway, we have been at this vaccine game since early December. I think, you know, I'll try my best not to be duplicative of what Tom covered, but it's, you know, I think the interesting thing is that the counties, I think everybody should know that the counties are not in control of allocation of vaccine. You know, that's being done at the state. The governor is working with CDPHE on the prioritization. And so I think for us, it's a, you know, there's so many things that change day to day, week to week on this thing. I think the best thing that I continue to tell my staff is that, you know, work hard on the things that we can control. And what that means is communication and our relationships with our partners, specifically our vaccine partners. And so I think that's where a lot of our focus is. Just to summarize, we have three main strategies in Weld County that we're employing. So the first one I just mentioned is building a robust network of vaccine providers and getting us all on the same page and rowing in the same direction and kind of putting aside kind of those normal market competitions to come together for the good of the people of Weld County. And I have to say, you know, it's been amazing, the response. You know, initially for reach out for providers, the state did it, and we only had about 10, maybe 10 or 11, but we've grown that number through really actually specific selection of providers due to their regionality, due to health equity focus. So we've grown to about 40 partners, vaccine partners that can push about 11,000 doses a week on average. We're currently only receiving about 4.5, somewhere in the range is between 3.5 and 5,000 doses a week. So considerably less than Larimer County at this point, even though our population is not that different. So we still have some challenges around vaccine allocation and you know, it's very difficult. We've got many providers that have made sacrifices both financially and otherwise to get into this game, and they've been ordering for weeks, sometimes 4 and 5 weeks, and receiving nothing. And so we continue to advocate for them. We continue to share vaccine with them when it's appropriate and when we're able to do so. So there's that strategy. The second strategy is to maximize our output at our internal clinic. Right now we're doing 400 first. We're fixing to change March 1st. But right now we're doing 300 first doses and 300 second doses a week for a total of 600 doses. We're going to up that capacity to 400 first doses, and then obviously the transition to 400 for second doses. We're using Moderna, so that time frame later, almost a month later. And so that continues to go well. We have not, we're doing a really great job on making sure that we only schedule appointments for vaccine that we have on hand. So this last week with the winter delays, we did have to cancel some first doses, but we have yet to have to cancel any second doses, which I think is kind of super important about the credibility and confidence in the system to get your second dose. I think people understand weather delays and things like that, but that's super important. Lastly is I did kind of, this last strategy is around mass vaccination efforts. You know, Tom touched on that a little bit, large, small pods, working with different partners, UC, Banner, Larimer, Sunrise. And then a component in that is also our health equity plan it's a joint health equity plan that was recently submitted to the state for their consideration. That was joint between those partners, again, UCH, Banner, Larimer, some of the larger providers from the two counties. So what Tom said is spot on, that, you know, one of the challenges that we have is not being in control of the plan, generally speaking, and the allocation. The good news is that our partnerships are strong. And even though we don't know what we're getting and we don't know when we're going to get it, we continue to try to work together to plan for that as best we can. So just real quick running through, we're about 8.3% in progress in Weld County. About 7.6% of the total population is completed the vaccination series. Our 70 plus is doing pretty well for the first doses, much like Tom. I think we're close in there, or much like Larimer County and Tom's group, we're about 65% there. Opportunities for improvement or continued improvement. Obviously, our Hispanic population being less than 2%. I think that probably goes for all minority groups, poverty as well. I do think that it's hard to really demonstrate how the health equity is going to work when vaccine supplies are so low. I really believe that's a challenge for us right now in that group. Let's see. Yeah, I think that's about it for right now. I'll stop there.
Great. Thank you so much, Sean. This is so exciting. Even just barely getting into this panel, I just feel like this is the light at the end of the tunnel. And so it's really, it almost makes you kind of emotional. All right. We're fortunate as well to have some representatives from a couple of our larger providers in this area. I am going to ask Natalie Yunt from Banner to go ahead and introduce yourself, Natalie, and maybe tell us a little bit about your role related to the vaccinations and then how things are rolling out at Banner.
Sure. Can you hear me?
Yes.
Great. So my name's Natalie Yunt. I'm the Director of Pharmacy at North Colorado Medical Center. We have been helping with distributing the vaccine to our clinics, our Banner Health clinics in the area, both on the Weld side and the Larimer side. So that's kind of been our major role, is helping with the distribution of what the initial doses that came to us, as well as subsequent doses. Also education for our staff as far as administering those vaccines in each of those clinics. So those are our primary roles from the pharmacy side.
Great. Wonderful. Let's see. I am going to have Rob Wagner introduce himself from UC Health. And tell us a little bit, Rob, about your role as it relates to the vaccinations and how things are going at UC Health.
Great. Well, good morning, everyone. My name is Rob Wagner, and I'm with UC Health. My role in the vaccine clinics is I'm the operations lead for our clinics in the north. And what that entails is our brick and mortar locations that are fixed at our hospitals in northern Colorado, Longmont at Longs Peak Hospital, Greeley Hospital, Medical Center of the Rockies, Poudre Valley Hospital, and Yampa Valley Medical Center. That is operational support from everything from our brick and mortar throughput, process improvement, parking, and obviously vaccine allocation. I also work as our point of contact for our county local public health authorities, and I think, as both Sean and Tom have said, it's been just a tremendous partnership as we've been working through those, as well as other external agencies. We're also doing, as Tom had talked about, pop-up clinics, our satellite outreach clinics. We've been working with several partner agencies throughout the community to make sure we can get vaccine to those populations where they need to be met. So this morning, actually, we have a clinic in Evans with Sunrise Partnership at that location at their Monfort Family Clinic. We've also done partner clinics with them at Island Grove. We've done partner clinics with Columbine at the Drake Center. We've also done partner clinics with Innovage and folks that have other mobility challenges. And so that's really what we've been focused on. We've been vaccinating for 71 days now, and so we've learned a lot. And so part of my role is continuously improving our process, and certainly the challenges about vaccine supply and inconsistencies on those have been, we've been affected by that just like everyone else has. But it's been really great to work with all of the partners in the county to ensure that we're getting enough vaccine as soon as we get it out to the community where they need it.
Thank you, Rob. That's excellent. Do we have Kim? Do we have audio for Kim?
I think so. Let's give it a go.
Okay.
I'm here.
Yay! Hi, Kim. If you could tell us a little bit about yourself and your role as the COVID, and then, like I said, I understand you have a few slides.
Yeah, absolutely. So my name is Kim Uran. I'm a nurse by trade, but I'm in a regional director position with Kaiser Permanente, Colorado. We are super excited to partner with all our different communities from Fort Collins down through Pueblo and Colorado Springs. As you guys all know, we have locations all over the place, but just really excited what we've been able to do in response to COVID-19. If you guys want to start sharing our slides, I'll go into them a little bit, and then I'll dive a little deeper into kind of our approach with the COVID-19 vaccine specifically.
Okay. Can see them. Yep. We see them.
Can you guys see them? Okay. All right. So this is just Kaiser's global approach to responding to COVID-19. We've really increased our virtual telehealth encounters, outpatient care, video visits, and obviously cost savings and cost, waived fees for a lot of our members and community patients. Next slide. So as far as our community COVID response, we've done a lot for the community in Colorado specifically. As we are spread across, for such a large footprint, we're able to really try and help support in different areas and different communities, as you can see on this slide. I won't go into that specifically. Next slide, please. So vaccine locations, this has kind of been an up and down roller coaster depending on, as everyone said, where the state's allocating vaccine. And so this list of 16 is our current list as of the last 2 weeks. But obviously, if we've registered all of our locations as phase 1 providers, and so if vaccine is sent somewhere by the state on an allocation need, we obviously get that location up and running. But these are our primary vaccine locations that we're using pretty much daily, 6 to 7 days a week. Sometimes we don't have enough vaccine to do our weekend clinics. I would say just based on this list, we have our larger clinics that are able to accommodate larger numbers. At our Lone Tree and Rock Creek locations, we can do about, on a weekend day, we can get about 2,000 members or patients vaccinated, first or second dose. And so we really pride ourselves on that. And then even some of our smaller locations, we can do throughputs, even on a weekday when we have clinic operations, up into the 800, 900 numbers. So I'm really excited to be able to kind of pump out some mass numbers when we need to, when we're given that allocation from the state. Next slide. Here's just some information on what we've been able to do so far to date. This is the number of providers in Colorado, but based on allocation, we're really able to get 50,000 vaccines administered in a week. We did a large weekend rollout mass clinic, but it wasn't at one location, but we were able to vaccinate 19,000 patients and members. I think one thing that what sometimes can confuse our community partners is that we are vaccinating non-KPCO members. So just community patients, we have avenues for them to get vaccinated and are really excited. Our numbers from yesterday, we'd vaccinated about 51,000 members, but we had also vaccinated about 10,000 non-members. So we know that, there is an easier avenue to get our members that have Kaiser insurance vaccinated. We do have an open approach for anybody in any location demographic to get on our virtual queue/wait list. We kind of go back and forth and toggle between what we call that. And I'll talk a little bit about that process. So if you go onto kp.org, or we have a call-in number, and I don't think that's on the slides, but I can definitely get it to you guys. Anyone can call and get on our virtual queue. I think we have about almost 400,000 people on that list right now. And we know that those patients/members are probably on a lot of lists. And so we are daily updating that data based on the CIIS data and our members charts and things like that. So we do move through those numbers pretty quickly. Obviously, we're focused on the phase 1A and 1B.1, I think we're in 1B.2 because of teachers. And so we're focused on all of that as well. But really trying to get through our 70+ goal for the state is kind of this week's key goal. We are going to be doing about, now that we got last week's second wave estimated to arrive and hit our clinics this morning. We're estimated to do about 16,000 to 17,000 first doses in the next 4 days. And then we're going to be giving, I think it's about 11,000 second doses in the next 4 to 5 days. So I'm pretty excited about what we're able to do and really looking forward to partnering with your community and your guys' location up north at what our locations. You know, we have smaller facilities up there, but we are getting a lot of doses allocated by the state, probably based on need, to those locations. And so really eager to partner with this community specifically on what we're able to help you guys do for your community members. So that's it.
Great. Thank you so much, Kim. I have several questions that were provided in advance. So I'm going to start on those, but I will encourage our listeners that if you have any questions, go ahead and put them in the chat and we will try to take a look at those as well. The next question is about how the organizations rolled out the vaccine, kind of how they prioritize their distribution and process and cost to the individual and insurance. And I know that we've kind of covered some of this in the introductions, but I think I will go ahead and start with Natalie and tell us a little bit about how that's been done in one of our provider organizations with Banner.
Sure. As far as the rollout of the vaccines, the decision was made to have them administered in our brick and mortar in the Banner Medical Group clinics. A part of that, some of those decisions were made to facilitate those second doses in an easier fashion, as far as having the ability to schedule that second appointment. A few other reasons for doing that were an automatic upload into SIS for those patients in the ambulatory care setting. We use Cerner, and so the two do not have an interface between the inpatient side and the ambulatory care side. So it was going to be much easier to have it on the ambulatory care side and assist with that automatic upload into SIS, as well as the second appointments and being able to schedule those ahead and have reminder calls. That was kind of the main points behind why that direction was chosen.
Okay.
So we originally received the vaccines at the hospital side, so we right away got our agreements in place to be able to transfer those to those clinics, and got a team together to coordinate all those that were needed to be there, and got going right away.
Great. What is the cost for the folks that you were vaccinating? How was that?
There shouldn't be any cost to any of the patients.
Okay. Great. Rob, can you talk to us a little bit more about how your rollout, sort of how you prioritized your distribution and process for requesting and getting that vaccine, and then any cost involved?
Sure. So as I'd mentioned, we've been vaccinating since December 14th, but the planning really started months ahead. And so similar to what Nancy had said, we've been working with our electronic health record to interface, making sure we're able to schedule first and then immediately schedule second appointments and those types of processes. And then the state had been designating pre-positioning sites across the area. Our hospital at Greeley was designated a hospital pre-positioning site with the ultra-low freezer capability, so we could ensure cold chain storage supply. So with that, we were then partnering with other providers in the community out to Haxton and in Greeley and others to receive the vaccine and then make sure we were able to get it to those providers as soon as they could use it, but not jeopardizing that cold chain storage. So that was some of the early work that we were doing in conjunction with the state and the counties. Certainly with that, we were working with Sean and others over in Weld. From the tiering structure, it was very clear how the governor's office had designated it. And so, as we look at our 30,000 employees, we really were taking a critical lens to those that were in COVID units for, with direct exposure for 15 minutes, all of those types of things. And so we tiered those folks down to a fairly narrow list across the health system. And then working through as others got released, from 1A to 1B and 1B1 and all of those types of areas. And then we worked really closely with the counties. I think one of the things I think Weld and Larimer have done just extremely successfully is create a joint survey for the community, so they can identify folks on their list that they have in the tiered structure. And so we worked really closely with them. We were having multiple calls a week to identify folks that we would be queued as UC Health. They also had other providers that they would assign different areas, childcare providers and schools and those types of things. And so our tiered structure has been really successful as a partnership with the counties to make sure we're hitting all of the populations that are in our categories. So that's been, I think, really critical. We're working across the state and other counties, and there's just so many more that are not as organized as they are in Northern Colorado. And I think it's a testament to already being at almost 70% for the 70 plus. We've administered about 67,000 doses in Northern Colorado. So I think all of those things has been very seamless, but it's a testament to the group collectively up here in Northern Colorado.
Absolutely. And Kim, you had mentioned that you were taking non-Kaiser patients as well. How do you if you could go in a little bit more detail about how you prioritize that and what are the costs?
So no cost associated with this. If it is a non-member, we will collect insurance information if they have it, and we will bill that insurance company for the administration, but not any costs related to receiving the vaccine. Mm-hmm. And then if they're uninsured, that's totally fine as well. And then as far as the tiering system, so our system, we use Epic, as most of the health systems do, but we have an e-visit created. So whether they go on to our kp.org or they call in, they're walked through an e-visit, which kind of answers questions and tiers them in the appropriate phase. Mm-hmm. And then based on that, we have that virtual queue list that I talked about. And as we have appointments available, we release what's called a ticket in the system. And with that ticket, we usually go 20% over what appointment slots we have available. And then if they did sign up on that kp.org web-based platform, they'll get an email and they can just press a button and that automatically books their first appointment. If they don't have that, we send out either text messages in phases and batches. So if they aren't on that kp.org, our system identifies that. They'll get a text message to their cell phone, and it'll tell them to either go on to kp.org or call into a number to get that appointment booked, or else they get a call, a voicemail, and then if they have no means of, IT phone communication, then they would get a letter saying, when you have a chance, call this number. You've been identified as your phase has been reached and your ticket number has been called. So, yeah. And then it's all based on phasing. And so as the governor and the state changes their phases, they become available to get a ticket.
Wonderful. So we have a question in the box. We have a few. I'm going to go ahead and start with one that kind of follows on to this topic, which is how are organizations determining which patients qualify at each priority level? Is that facilitated by the counties? Can patients' employers be proactive in self-identifying to expedite access? So how are we determining kind of, where folks qualify at the different tiers as they come out or announced by the governor?
And Angela, I can take the stab at that first. And that's that online survey that Weld and Larimer were sharing that Rob talked about. There's a piece on there that's the provider survey. So if you believe you're eligible, you enter your information as the employer, how many staff you have, what they do, that gets in the queue. And that's really how we're doing that. As far as we've been asked when people show up, for the most part, it is an honor system. We want, if you're a dentist, well, they're great, then we'll get you the vaccine. And we've only had a couple minor situations where maybe that wasn't the case, but for the most part, it's working real smoothly going off that survey, and people get signed up. There has been a few glitches, and that's why we have that phone number so people can call in case there's an error and make sure they can get signed up quickly, because we don't want them falling through the cracks. And Sean, I think that's how you guys are doing it.
Yeah, that's right, Tom. Same thing. We've got basically, I like to call it Well, official name is like the information and notification system. So either for individuals or groups, they can, when you go to our website about, where can I get my vaccine, very similar to Larimer. We're trying to push out provider information so that we can help connect people. But also they get into this, what I like to call it, you have to forgive, I come from Texas here, so a holding pen. So one of the lessons we learned right away was, get people in an enrollment that want the vaccine, get them kind of into a holding pen, and then draw from there from your appointments, and work with partners who have capacity. And so that's the way that we're doing it. We are in regular contact with those people that enroll in that system. We try to push notifications to them every couple of weeks, if not sooner. For example, we did one sooner this week due to the weather delays and the shipping, to let them know that, they're going, as they hear in the news, that things were delayed and that some, us and some of our partners were going to have to cancel appointments based upon that. So that's kind of how we're doing it. But it really is better on our groups when we do it by invite. So they get these folks either get a phone call, or they get like you said, like Tom was talking, a text message or email that says, hey, listen, your spot in the queue has arrived, and here's the instructions to get scheduled, whether that's with us or with partners.
Great. There's an interesting question here. I'll be interested to whoever wants to take this one. Is it easier to use public health to get vaccinated as opposed to waiting for your number to come up with a different organization? Any thoughts on that?
I'll take this one just based on what I've heard. I think that a lot of community members are kind of putting their hats in all different buckets, right? And so taking their chance on whatever option comes up first. So, if they hear that Weld County or Larimer County is going to get a shipment, or UC Health is, doing a mass clinic, then they're going to get on their list, and they might stay on Kaiser's virtual queue, and hopefully whoever gets called first. I think that's, it's just based on state allocation as we've heard, and we're at the mercy kind of the governor and the state of, what week who's getting the most doses. And, it's just whatever we can get shots in arms. I think that's why we're all on board and on this journey together. So.
Absolutely. Okay.
This is Sean. If I could just jump in, I wanted to mention that there was a question about, asking people that are coming to give some sort of documentation to justify themselves. With our team here, I really wanted to go in a different direction there. I didn't want to be perceived as us being gatekeepers. I understand we have obligations and requirements, but I really think that, to Tom's point, it's been about the honor system. And I would agree also, we've had a similar experience with Larimer's, very little issues with that. It is really encouraging, especially I have to say, for our 70+ population. They're there 15 minutes early. They have their paperwork ready to go. They're very highly engaged, and I hope that as we move through the phases that continues with the groups. It's been really great.
It's good. I have heard stories of folks dressing up as elderly folks in other states to try to get themselves in line first. So it sounds like with our honor system, we have not had those sorts of issues here. I'd like to switch gears a little bit to talk about employee vaccinations and some organizational mandates that employees be vaccinated. So for the employers, based on what you've learned through the early stages of the distribution, what is your opinion of having an organizational mandate for COVID vaccination?
So at Kaiser, we're not mandating. I think it's a slippery slope with the EUA and, this emergency release of the vaccine. Obviously, we highly encourage it. And I think that's where our challenge comes is we're going to get to a point where we get everyone vaccinated that wants it. And then our real challenge, I think all of us combined, is going to be getting those people that are hesitant or on the fence vaccinated. And that includes employees. But at this time, Kaiser Permanente has not taken a stance of mandating. And so it's, if you want it, we will give it to you if you are a frontline worker and take care of patients. And then if not, our other employees fell in the appropriate phase based on what they did. You know, we don't have staff working in an ICU and in a room with a sick patient for an hour. And so we still prioritize our staff based on the phasing. But if they wanted it, they were able to get it if they qualified, but we did not mandate it.
And UC Health does not mandate the vaccine either. We do look at it even by job code of who has accepted it. And I think one of the questions that we're going to have to face collectively as a community is really vaccine avoidance and education out in the community. I think that's sort of our next level as we continue going through the next phases in the vaccine allocation. But you know, we're not mandating it, but certainly education. I know PSAs are going out. I know, Sean, I know there's some stuff going out in Weld County as well to folks that are maybe more hesitant than others to receive the vaccine. And so that's really sort of the next phase is the education for the folks that are avoiding vaccine for whatever reason.
And that's similar for Banner Health. We are not mandating it. We have already started that education to try and help those that maybe have questions or don't understand how they work. So that has been something we've done through town halls with our employees.
Yeah, that's what are, in addition to so we've got education and public health strategies or PSAs. What other strategies are we using to try to change hearts and minds for the folks who really are very skeptical? Because I know I've certainly come into I've met with some of those folks myself. So what are the strategies for that?
We're taking the strategy. We've got some outreach specialists that are working with different communities, whether that's our students at Colorado State University and Front Range Community College, our Latinx communities, school districts, people with other needs. And what we're trying, the strategy here is coming to them and listening and hearing what the barriers are. What are the challenges? Some of it is trust. There is a lack of trust there, and it's rightfully so. And we need to hear that, and we're getting that information back. And we're also hearing we need to be transparent. There are side effects to this vaccine. Now the side effects outweigh someone definitely going to the hospital and be intubated and put on a ventilator, for heaven's sake, sure. But we need to be, I think, let's be transparent. Let's have those conversations. And tell what people will know, what we're learning along the way. I think if you're more transparent, you meet people halfway, you listen to them. Why are you hesitant? The big one we're hearing is, you're the government, Tom. And I don't really trust right now, especially a few of our communities. And when you listen to why, it's like, oh my goodness, I understand. So there's some work to be done. It doesn't happen overnight, but our outreach specialists with lived experience and part of members of the community are coming back with some information that I'm going, okay, this is some good information that we can work with our providers. And whether that's working with places of worship, whether it's working with the businesses themselves, there is that trust and established relationship. I think that's where we're going to make the most headway. So that's the angle we're working at in Laramie County.
Great. Here's another question from our listeners. Do you feel there will be citizen concerns regarding the Johnson & Johnson one dose vaccine that we just heard about this morning, actually, some updates, versus receiving the 2-dose Pfizer Moderna? As the efficacy appears to be a little bit less, is that a concern?
I think from a healthcare standpoint is, really creating the education platform around what are we really trying to prevent. And I think Tom said it very well, is that it's keeping you from getting sicker, right? And so if Johnson & Johnson, if we can decrease that severe illness related to the COVID-19 virus, then that's our goal, is we want to keep our patients alive, out of the hospitals, and create, almost a safer way to get sick if you do get sick. And so it's preventing that severe illness. And so I think that's where our education and our outreach with the Johnson & Johnson vaccine will need to be focused on, is the percent of severe illness reduction with that vaccine.
Okay. Any other thoughts on that?
Yeah, this is Sean. I've actually kind of heard the opposite. I mean, the fact that it's a one-shot deal, the efficacy concerns are valid based upon your risk and exposure. But I would just wanted to add that one of the things I think about Johnson & Johnson is I think about our folks experiencing homelessness, a lot of the migrant transient population. I think a one shot, even though you're going to see that lower efficacy, I think is going to be tremendous. I really do. A helpful tool, options for us to have, to bring to bear, to leverage with our partners with these populations that if you looked at, completing the series and things like that almost a month apart is a tall order by anybody's estimation. And so that's what I've been hearing about the Johnson & Johnson, is that there's actually some excitement from a health equity for specific populations as well. It can be a very helpful tool.
Absolutely. I see Tom posted a Wall Street Journal article. Is that the one that I heard this morning on NPR? Information about that?
It is. That's the one that was in the
Awesome.
NPR, yeah.
Thank you. Wonderful. Yeah, I think we'll be hearing more about that.
Yeah, Angela, I was just going to say my thoughts were a couple things. So I think your first question, are people going to question it? Yes, I do. And I think what Kim was saying, education will be important. The other thing is it's not an mRNA vaccine, so it makes me wonder if people may trust it more. I don't know, that's just a question I have. We'll have to see over time.
Interesting point. Yeah, absolutely. I have another question. Let's see, Nate wondered, will the county, and I'm going to say counties, be providing any updated COVID protocols, guidelines for fully vaccinated individuals? So, or will we take our direction from the CDC, which is expected to issue such guidance shortly?
The answer is yes. We've actually updated our quarantine letters. So if you are 10 days post your second dose, unless you're showing symptoms or something, you do not have to quarantine. So there's some of that pieces, but that's big for our educators, schools, and keeping in-person learning. There will be more guidance. The State Health Department, I think it's this Friday, will give us more specific guidance for other situations. But yes, you'll be getting that guidance. We'll be working closely with the Colorado Department of Public Health and Environment, which we work closely with CDC. But the short answer is yes.
Thanks, Tom. Appreciate it.
Wonderful. Let's see. I have a couple of other questions here. We still have a few minutes. So those who are receiving the vaccine are provided proof. What do we know about how this documentation may be used in the future related to the workforce, and I would say to travel or to anything? Any thoughts on that?
Right now, we don't know. That's a great question. My neighbor asked me that the other day. Hey, if I travel this summer, do I need my vaccine card? That's a great question. I think that's a lot to be worked out. I think we'll see what the State Health Department has on that, and probably CDC as well, but I don't know yet. I'm recommending everybody keep it in your wallet or your purse. Make sure you have it, because I don't know, but because it could come to that. But I don't know right now, and I hope we get some guidance here in the next month or so.
Yeah, this is Sean. I would agree with Tom. It's kind of murky. You certainly see this being used as a tool in other countries around the world for access to different things. You hear stories about that, read articles about it. I think it has a lot to do with I couch it with the political determinants of health, but as you can understand, we don't know what the vaccine or what the virus is going to do. We have these variants running around. I think it's really going to be a question of what else does COVID have in store for us. And if we get into a challenging or desperate situation, it may necessitate, our leaders may look to that as a tool to help control this or stop the spread. So it's certainly, I think we have to be honest that there's that possibility out there that it will be used as a tool to help slow the spread if needed.
Okay. Yeah, I think that's a really interesting question. Another headline from yesterday was how there were a great number of doses that were discarded in Tennessee and other places, due to the weather and the storms. So I am interested in, have you guys experienced having to waste doses, or how have you avoided that, or how have you dealt with that?
I'll take this one because it was on the news when Kaiser had to waste 200 doses. So we have ultra cold freezers at 2 locations. So those 2 locations have Pfizer. But at our other locations, because we are outpatient ambulatory clinics, we don't have backup generators at all our locations. So our Lakewood fridge went out of range overnight. It was early on, it was a few weeks ago. And so the process to get a hold of Moderna, we had to wait for them to call back. Once we got their, excursion okay, then we had to wait for the state to call us back. And by that point, I think they called us back at 3 p.m. and it was about 360 doses. We had a half an hour to give those 360 doses. We were able to give 160 in a half an hour. To members within the building, but we did lose those 200 doses. So it is a struggle. I think our pharmacy and leadership is working on equipment to put in place to prevent that. Our EOC has worked on what happens if another fridge goes out of range, and working closely with the state on how we can use all those doses in a more efficient time frame. So hopefully we can avoid that in the future.
And at UC Health, our ultra lows are at each hospital and are on our backup generator system. As such, we've not wasted any doses throughout our health system during this process.
Yeah, and at Banner, we also have an ultra low freezer at NCMC, and so for the Pfizer product, that's where we've been storing it. So even in the beginning, when we were using more of the Moderna as well, we were keeping it in our freezers at the hospital, and there was caution about how many we were going to be sending to each of those locations. So we were very careful with how many we sent, just in case they don't have a backup generator. So very cautious. As things have shifted more to the clinics ordering, that's still a concern, because now they're responsible for keeping most of that on site rather than having us distribute it to them directly. But we have not wasted doses. Some of our strategies for that have been, we have just backup lists, the on-call list that is in each of the clinics, and they reach out towards the end of the day. And this goes for even some no-shows, or, as I think it was Kim that mentioned earlier, people sign up at different places. So they'll say, oh, I actually got mine somewhere else. So then we have, if you want to call it a no-show, then we would have to call people for that backup list. But that we've been successful with that, and we haven't had to waste any doses, fortunately.
And thank you for that, Natalie. I think that's an important piece. Colorado did a great story. It was last week. We have wasted no doses, and we've only had Moderna, so we haven't had some of the challenges with Pfizer. We do have an ultra cold freezer just when Pfizer does come available. But early on, when you open up a Moderna, you got 10 to 11 shots, and you only have 2 people there. You got to find arms. You're not wanting to waste it. And it has been our objective to not waste. But we've gotten a lot better with our scheduling system. For example, our clinic recently, we had some no-shows, and we had 2 people. We opened up a Moderna, so we need to find 9, 10 more arms. And we did a call-down list, and it's working great. We can get childcare providers, we get some of our educators. Usually it's later in the day, so it accommodates them for 65 and up. We tell people, boy, sign up, and do you have the means to be here in one of our clinics in 45 minutes? If they hit that check button, then we put them on that call list, and it's been working pretty well. The one thing I would ask everyone here on this, if you hear of somebody that's signing up for everything, we've heard that. If you get an appointment, decline all the other ones, because you not doing that really, really interferes with our system, because we don't want to waste any doses. We want to get them into everybody's arms. But when we're standing around at 7 o'clock at night, and we're trying to see, like last Wednesday with the snowstorm, we literally had to go another 2 hours to accommodate people to get there. We were at the ranch, where that could have all been avoided if people would have canceled with us earlier that day. We could have filled those slots.
Fantastic. Okay, I have another question. Are there needs for personnel to help administer the vaccine, and how do interested professionals go about getting connected? So do you have volunteer needs?
So I'll take this one because, or I'll start this one. We sent a press release out a couple weeks ago asking for providers. Right now, vaccine allocation or supplies are our limiting factor, but maybe that will not always be the case. Certainly hear of situations in other states, and so I think we try to do some prudent planning. We sent out a press release. We got an overwhelming amount of response of people, hundreds of people. Retired, active licenses, everybody meeting that, the governor's executive order about who can administer vaccine. And so it was just very overwhelming. And I wanted to say what we are doing, and I believe that the state has also let providers know about Colorado Volunteer Mobilizer.
Mm-hmm.
I think that's one of the challenges when you get, it's great when you ask for help and you get a lot of help, but volunteers, as everybody knows, can be really wonderful, and they can also be a real challenge. So having an organization that's able to step up and help us with the management. And also I think the beauty of Colorado Volunteer Mobilizer is that it allows people to say where many play, not just their local community, all over Colorado. I know we've had some needs for vaccinators in some other parts of the state. And so I just think that component that, somebody from northern Colorado can be helping out on the Western Slope or something like that, as well as their local communities. And so that's what we've done, and it's working fairly well so far. So.
Any other? Go ahead, Natalie.
Yeah, this is Natalie. I was just going to comment about, I feel like what we've run into is lots of people who are able to administer and help with that. And as Sean said, it's limitations of how many vaccines we have. But one of the more challenging pieces, honestly, is the preparation, I would say, of the vaccines. The Moderna is much easier, but Pfizer, definitely there's some prep time that goes with that. I don't know that everyone's aware of all those pieces of sitting at room temp for a certain amount of time and how fragile the vaccines are. So being careful not to shake. It just takes time to prep those. And so what we run into is we need to train more nursing staff to be able to help with that piece of it versus the administrative side of it.
Okay.
And if I could just really quickly, Natalie triggered me with something she said. It's really important for people drawing up that vaccine. It's really becoming an art at trying to, and it depends on the lot you get, but it becomes an art form of being able to draw out these extra doses and using the right needle and really finding the right person to do it, quite frankly, and makes all the difference. So that really resonated with me, Natalie, when you talked about that.
And I think, Sean, to Sean's point, at UC Health, we've taken that approach. We want to standardize this process as much as possible to ensure we're getting all of the vaccine and maximizing the process. It also is throughput. So if we have folks in those areas that are not as familiar with it, it backs up our queue and it's not as efficient. So we've hired, or in the process of hiring, over 100 different FTEs to help with us across our process in the state. We do have some volunteers that are already UC Health volunteers, and they help with traffic mitigation and with some sort of people management in the process. But for a large part, our actual staff going through the vaccine process is UC Health employees.
Okay.
We are directing folks that call us to the county websites or to the volunteer spots that the governors are pushing out, or the governor's pushing out right now. But for us, we're utilizing our own staff.
Great.
We've been using volunteers from beginning with testing COVID-19, and now that testing has come down a little bit, which is good. We're moving them over to the vaccination, and boy, they've been awesome. Whether it's moving supplies around, as Natalie said, you got to have certain things set up for our MAs and our nurses and the folks giving the shots. Whether that's registration, we try to do like the Chick-fil-A setup where we can try to get people registered on the iPad. So we've got volunteers there. We've got volunteers for traffic control, as Sean said. Today we have a big clinic at the ranch. We're going to try to vaccinate 700 people in about 5 hours. So lots of moving parts, and boy, we couldn't do it without our volunteers, and we really appreciate every one of them that come out week in, week out to volunteer and help our community.
Well, we have come to the end of our time. I want to thank you all so much. This has been fascinating, and I could talk with you all probably for another hour. I probably have another 100 questions, but thank you so much for spending your morning with us. I'm sure all our listeners are glad to get the information and to be able to ask the questions. And so I will go ahead and close this now and turn it back over to, let's see, Nikki, who's up next?
Joanne will chime in.
Okay. Hey, Joanne.
Good morning. Thank you, Angela, for your fantastic moderation. And thank you, panel members. Great information this morning to share with our members here today. It strikes me how fortunate we are to have such successful collaboration in our Northern Colorado region. So thank you all for your leadership for that effort. We're going to switch gears this morning. We have a special guest, Jean Dougherty, with us today. She represents Colorado Workforce Development Council and the Colorado Department of Higher Education. And Jean's going to share with us some trends in healthcare talent specific to Northern Colorado. Jean, welcome.
Thank you so much, Joanne. And I am just going to dive right in for the sake of time. Just for some background information, in 2014, CWDC was charged by legislation to create a cross-agency annual talent pipeline report. The 2020 report is the 7th release, and I'm just going to be giving you some snippets from the report that are really relevant to your group. And don't worry if you don't have time to take notes. I am sending out these slides and they will be distributed. And I do have a resource slide at the end of all the links that I'm talking about. Since the first iteration of the report, there's been 50 bills related to talent. This year we cover the typical things, labor force data, strategies, and recommendations, but this year we also add in COVID-19 impacts, business resources, and a workforce roadmap. And that's really a cross-agency, a collective action plan developed jointly by state agencies to build upon existing strategies and work in close alignment across sectors to strengthen Colorado. I'm not going to dive into that today because that would take me quite a while, but you can find more information within the report itself. First, we start off with demand. Another important factor to note as we're going through these slides is that employment and wages data lag considerably. So the following information analyzes what available data we have in an attempt to look at the most recent workforce data through COVID-19. I do have some regional and industry specific information for you all as well. First, we looked at emerging shifts in demand. COVID-19 has accelerated the future of work trends. Trends we initially thought would take more than 10 years to occur happened in a matter of weeks, requiring us to quickly adapt and adopt strategies to fit the current reality and the new predicted future. We need to be flexible in our response and strategies moving forward, especially as new information and data become available. The current and future nature of work calls for continuous learning and training to keep up with the shifts in demand. Digital literacy, agile learning, and work-based learning all are and will be in demand in Colorado's labor market. This is the top posted occupations within your region, not just in the healthcare sector. I do have the healthcare sector next. You see heavy and tractor trailer truck drivers, registered nurses, software developers, retail salespersons, and stockers and order fillers. This is really congruent with kind of what's happening in different regions throughout the state. This, however, is the top posted healthcare occupations from March 2020 to January 2021. You see that registered nurses, home health and personal care aides, nursing assistants, LPNs, and licensed vocational nurses all top the list with their online job postings. One caveat with this data is that it only accounts for online job postings and it doesn't capture the full picture of really what's happening in rural areas or occupations and industries that may not rely on job postings. So this really gives us a general direction of who's posting the most, but it's not a definitive answer of how many people are hiring in what positions where. Another thing that we look at are the top posted technical and essential skills. In contrast to technical skills that are specific to jobs and industries, essential skills are more general personal qualities that help facilitate interactions with others and are associated with workplace readiness. You see that communications, compassion, and customer service are the top 3 essential skills in online job postings for healthcare occupations. And for technical skills, you see nursing, basic life support, and CPR. I also was able to pull the different certifications or qualifications that were in different job postings for healthcare occupations. This is really congruent with the top posted occupations themselves, so it really matches up nicely. You see the LPN, the CNA, the critical care registered nurse, and once again, you will get these slides, so if you don't capture this now, you will have it later. Once again, these are from online job postings, so it might not capture the full scope of what is happening in hiring within healthcare occupations. Really, we don't know what's going to happen in the future. As I mentioned before, we've yet to see the full picture of data related to the pandemic, and COVID-19 is a novel experience globally. Therefore, it's hard to predict the future of the workforce with certainty. And as time goes on, short-term and long-term impacts on our economy and workforce, as well as effective recovery strategies, will become more clear. However, even before the pandemic, the future of work was already emerging and has always been a progressive change in our workforce. With the development of new technologies and increasing efficiency in how work is being completed. With the onset of the pandemic, these changes were no longer gradual, and it has resulted in an increased need for digital literacy and inclusion. To use information and communication technologies to find, evaluate, create, and communicate information, requiring both cognitive and technical skills. Digital inclusion is defined as activities necessary to ensure that individuals and communities, including the most disadvantaged, have access to and use of information and communication technologies. In the last 10 years, demand for jobs requiring medium and high digital skills has increased, and jobs vulnerable to displacement or significant transformation due to technology are disproportionately concentrated among people of color, those without college degrees, and workers under the age of 34 or over the age of 50. And this leads me to introduce the foundational skills for the digital economy. These skills are becoming increasingly important for employees and job seekers to stay relevant and qualified in the digital economy. These skills can be grouped into essential skills, technical skills, and digital building blocks. A combination of these skills has been associated with opportunities and higher wages for workers. However, only 1/5 of workers' resumes have skills in all 3 categories. Essential skills include communication, critical thinking, and collaboration. Technical skills include project management, digital design, and communicating data. And digital building blocks include data management, programming, and software development. Another way we define demand in the report is through top jobs. A top job is an occupation with more than 40 annual net openings, an above average growth rate over 10 years, which is 10% job growth over 10 years, and a good wage. A good wage is where the top jobs are broken down into tier 1 and tier 2. Tier 1 is a living or a wage that can support a family of 3 with 2 adults, 1 working and 1 child. And then tier 2 is a living wage that can support an individual adult. And although we're still using an above average growth rate over 10 years as a threshold for top jobs, the growth rate has been cut in half to a little bit below 10% over 10 years. So the methodology really adjusts for that. Statewide, there are 143 top jobs classified as tier 1 and 111 top jobs classified as tier 2. 62.6% of all the top jobs of both tier 1 and tier 2 require a post-secondary credential. However, 88.8% of the tier 1 top jobs require higher education. And you can see that on the light blue shaded area on the right. And as I mentioned before, the criteria thresholds for top jobs have changed. While we maintain adherence to the prior factor of above average growth, the average growth rate over the next 10 years has been cut in half. So the above average is much lower. However, we can also highlight the 36 jobs that meet the top job growth criteria that we used in last year's report, which is 20.5% growth over 10 years. 28 occupations meet tier 1 criteria and 8 meet tier 2 criteria. Of the highest growth top jobs, a majority fall into computer and mathematical, educational instruction, and the healthcare fields. This is the top jobs that are located in the Fort Collins and the Greeley metropolitan statistical areas. And you see registered nurses, nursing assistants, and medical assistants are really on there in those different areas. And you can use this, there's an appendix within the report, it's called Appendix C, and you can drill down by area, or you can use a different appendix, which I have linked out, to look at statewide top jobs, and you can filter out into healthcare occupations. We also dive into supply. I'm just going to give you a very brief overview of the supply, and then we'll dive into some of my favorite strategies, and then I'll open it up for some questions if there's time. Given the emerging growth industries and skills needed by the future workforce, it assesses the supply of talent and if it aligns with the demands of industry. Overall, Colorado ranked 5th in labor force participation. Men and individuals who have higher education are more likely to be in the labor force, and Colorado is the 2nd fastest in growth of individuals 65 plus. So this further highlights the demand for healthcare workers and upskilling and reskilling as people are living and working longer. Now I'm going to dive into a couple of my favorite strategies. The first one we touch on is equity. The CWDC released the Talent Equity Agenda, which is a holistic effort at raising awareness, identifying shared opportunities for strategic action, targeting resources, and measuring progress to address equity gaps and intersecting disparities impacting our current and future workforce. This was published at the end of September 2020. We will be publishing progress updates of the Talent Equity Agenda in future talent pipeline reports. I have a link out to this in my resources slide if you want to dig deeper. The report or the agenda focuses on 5 different areas: career navigation and advancement, closing the digital divide, post-secondary credential attainment, unemployment, and equitable hiring, compensation, and promotion. Which brings me to one of my favorite things to get up on my soapbox about, equitable hiring practices. This is only 3 components to certain equitable hiring practices. Skills-based hiring allows for industries to be more specific about their hiring needs, cast a wider net for filling jobs, and allows for a more diverse candidate pool in the hiring process. Employees and job seekers benefit from this because there's a direct identification of what's necessary to perform on the job, reducing potential educational attainment barriers for applicants. I understand in the healthcare field, I definitely want my doctor to have gone to college. And so it's basically stripping those certifications when you can. And I think that in the healthcare field, you have a lot of those necessary certifications. And they do a great job of outlining what competencies and what you learn and what you can do out of it. And so it's just kind of boiling it down to those specific knowledge, skills, and abilities within those certifications. Selection and recruitment procedures, when done correctly, may mitigate adverse impact and disparate treatment. For example, stripping identifying information from resumes may reduce discrimination based on gender, race, ethnicity, and other demographic factors. The third one is structured interviews. Unstructured interviews allow for implicit biases and overt discrimination to remain unchecked and really aren't valid predictors of job performance. Structured interviews, however, are much better. Interview questions are typically developed from a job analysis, usually only focus on a narrow scope of essential job tasks and skills, and have the same questions for every applicant. So structured interviews and skills-based hiring work hand in hand to aid in reducing discrimination and adverse impact by standardizing the process and focusing on critical skills necessary for successfully completing job tasks. Next, I'm going to talk about, for people to find the opportunity in the future of work, 3 digital inequities must be addressed. 1, access to affordable high-speed internet. 2, access to affordable web-enabled technology. And 3, access to high quality and effective training and support for digital skill development. The Office of the Future of Work, in partnership with the Colorado Broadband Office and other stakeholders, are researching digital literacy and the programmatic, technological, and educational infrastructure required to ensure all Coloradans are prepared to participate in the future of work. And the slide before it discusses some of the data points related to digital skills. We also touch on the work-based learning continuum, which has specific examples of apprenticeships, which includes the co-helps apprenticeship programs that are working to increase apprenticeships in the healthcare field. So definitely check that out. The report also discusses My Colorado Journey and Career Pathways, which has a healthcare career pathway on it where people can dig into some of the labor market data and skills necessary for being in the healthcare field. And so definitely take a peek at those links for sure. And we also highlight the return on investment for the WIOA programs. Specifically, over 300,000 job seekers utilized the public workforce system in 2019, and over $435 million in wages were returned to the economy. So continuing to support programs that have a direct benefit to Colorado's economy will be vital in the recovery efforts. And I know I went through that really quick, but I have my email down here. I'll pop it in the chat as well. And this is my slide with all of my linked out resources on it. So when you get the slide deck, you should be able just to kind of go to that and click through. I know we only have 2 minutes left, so I'll leave it up to Joanne or Nikki if I can field any questions.
Let's see. I don't think there was any questions in the chat. But maybe if anybody has something, they can chime in real quick in the chat.
You guys all got the speed presentation. I do have a link to a presentation request form at the end too. And so if you want me to dive in more or come into any other groups, I'm more than happy to do so.
Thank you so much. I appreciate that. And I don't see any questions in the chat, so I believe Yvonne, you're up.
Yeah, so I'm finishing. Thank you, Jean. That was, I've never been involved in a 15-minute presentation that was so impactful. It had such great information and such great slides. So thank you so much. We may have you back for a deeper dive, or maybe the Workforce Committee will for sure. So want to thank everyone for joining us today. We do like to end on time. So 1 more minute. So I want to again thank our panelists for the vaccine conversation, as that's up and foremost in front of everyone's minds. I pulled myself out of the participation on the panel because we had so many great speakers and we didn't have enough time. But I would like to end with Columbine did mandate the vaccine. And after the first dose, we only had 50% participation in Larimer County at our facilities and only 36% participation of staff in Weld County. We had 98% participation with our residents, and we're nearly at 100% at this point. So we felt like our residents were telling us what they wanted and what we needed to do. And I will end with saying that by mandating the vaccine, that did help our staff of those that had questions, those that believe everything in social media, those that had lots of misinformation, to come more forward and ask us for better information. And we're more open to having the conversation because we mandated it. So I just share that with you. And at this point, with over 1,500 employees, we only have about 34 that will not get the vaccine because we're allowing for if you're pregnant and have lactation and those sorts of opportunities as well. So we did mandate, and if you have questions or want to visit with me about that, I'd be glad to do it. But thank you so much. Thank you so much for joining the sector meeting today. I hope you have a wonderful Wednesday. Enjoy the warm weather before it snows this afternoon. So thank you so much. Bye-bye.